So doctor, can you just tell me that what is the main root cause of cavity?
So root canal condition comes only you neglect it.
So doctor, what measures can one take to prevent cavity?
They say brush twice a day. I say no. You should not hold it tight. मैं जोर जोर से करेंगे ना. If I brush heavy, I got the teeth become white. They become more yellow. So to brush this area brushing is very important.
So doctor, as per you, what is the right toothpaste one should use in their daily life to keep their teeth and their gums secure?
Now what is wrong toothpaste? The particle size of the toothpaste. A so-called whitening toothpaste to remove the stains. They don't actually whiten the teeth.
अभी शाहरुख खान ने भी एक इंटरव्यू में बोला that he has stopped smoking.
One other good thing, I'm not smoking anymore, guys.
I know Shahrukh because he was my patient for 25 years. Because he has stopped smoking, he is getting now good advertisement for the youth products.
I just want to know the effects of vaping on your teeth. Is there any home remedy to make your lips pink? And if you have darker lips, that can help you to change it into pink. Hi everyone, in today's podcast we have invited Dr. Sandesh Mahekar. He is a well-renowned aesthetic dentist, and in today's podcast we would be discussing about the importance of having a good teeth and smile. Then we would be talking about the law of manifestation, that how it really is true and how it can change your life. And number 3, why positive thinking is highly beneficial and important to achieve great amount of happiness and success in your life. Thank you so much, Dr. Sandesh Mahekar, for being here. It's a pleasure to have you here, and I'm sure that today's podcast will be highly insightful.
I'm also very happy to be here because I never leave any opportunity if somebody calls me to speak about my profession, because I'm very passionate about my profession. Because as far as dentistry is concerned, in the health sector is considered to be the last, because कोई मरता नहीं है यार उससे, तो लोग बोलते हैं कि यार देखा जाएगा. So I want to educate, I want to talk whatever you want to ask me.
So doctor, can you just please give me a brief introduction that how many years of experience you have in this dentistry field and what inspired you to being a dentist?
Basically if you see now, I don't have a website also, because I tell them you go on Google, you'll find out about me, because I feel website is I, me, myself, because that's my way of looking it. But then talking about me, well, I joined dentistry as a accident. My family wanted me to become a doctor. So I applied for medical, dental, Ayurveda, Unani, veterinary, OT, PT, सबको apply किया. So I applied for everything, and then I got in dentistry. I didn't even know there was a dental college when I joined in 1973. The one thing my dad had always told me that whichever profession, vocation you are, you should be number one. Try to be number one. तो तभी सोचा था बूट पॉलिश वाला बनेगा तो भी नंबर वन बनेगा. वो कुली नंबर वाले सब बाद में आ गए. So I just did that and I concentrated. I was a very average student. What I realized is observing and learning is more important than having a book knowledge, because book knowledge, everybody has the same knowledge. After becoming a dentist, I was fortunate enough to work with Dr. P.N. Bansali in Mumbai. I was very fortunate when I was doing my postgraduate. There I learned that dentistry is a very good profession, both for patient as well as for finance. Let's be very frank, everybody work for finance at the end of the day, but ethical finance. So then I said, okay, dentistry mein hai kuch to, there's something in dentistry. And he used to treat Dhirubhai Ambani, those days Lata Mangeshkar, etc. So once when Lata Mangeshkar came to his clinic, I came home and I told my mom, and I was staying in a chawl. I still have that chawl, 2 rooms. Marathi, I said, Ai. He said, Mom, I said, guess who had come to my doctor's boss's clinic? He said, who? I said, Lata Didi. And I just instinctively said, one day she will come to me. I didn't have clinic, I didn't have anything, but I just said, one day she will come to my clinic. But 88, I got exposure to aesthetic dentistry.
So doctor, can you just tell me that what exactly aesthetic dentistry means by?
Aesthetic dentistry is beautification of your teeth. If there is, and there are two types of, one is aesthetics and one is cosmetic.
Yes.
So I've defined smile into three definitions of smile in the world literature. First is aesthetic smile or designer smile. Like suppose you have got a gap in the teeth, or your tooth is broken, or crooked teeth. Getting into nature, natural, is called aesthetics or designing, like design for your face only. Second is attractive smile. If you see Priyanka Chopra, she came to us during Miss India time. So you see her teeth, we kept it little in and out. That's attraction. So Bollywood people require their smile to be little attractive, the people remember. And like Miss India, perfect smile. Okay, but Bollywood, if you see Shah Rukh smile or if you see Akshay Kumar smile, you remember them. So that's attractive smile. And third is cosmetics called beyond aesthetics. Like you put a makeup, you don't need a makeup, but I feel I want a makeup, I'm going to look nice. So that's cosmetic beyond aesthetics. Somebody wants straight white teeth. So these are the things. But basically, it's the general dentistry. There are 7, 8 branches of dentistry, out of which, except for 2 branches, oral pathology, in which I am master, radiology. All other branches have got one chapter that deals with aesthetics. So combination of all the branches of dentistry, the aesthetic part is called aesthetic. So today, we started aesthetic dentistry in 88, 90. Today, dentistry is aesthetics because whatever I do in your mouth has to look nice. You can't tell general surgeon do my appendix operation aesthetically. But what you do in the mouth is visible. So it has to look nice.
So, doctor, can you just tell me that what is the main root cause of cavity, which leads to root canal as well?
One has to understand that cavity for dental cavity is biochemical process. Biochemical. It's not only biology.
Sure.
There is some yoga karenge to, that you get, blood circulation is good, you get healing, nature cure hota hai. But as far as cavity is concerned, it's like a thorn in your finger. You can't take just painkillers. You have to remove the cause. So you have to remove the decay. So cavity happens in any food particles staying on the tooth surface, especially sugar particles, especially carbohydrate starch particles, stay on the tooth surface, attracts bacteria in the mouth. There are normal bacteria there, but they attract more bacteria, convert that tooth area into acidic, and then acid, anything can erode, so acid takes away the enamel. And once there is a hole, food particles go inside and then it goes on progressing.
So, out of the 3 categories which you mentioned, so where would you place root canal surgery?
That comes in basic surgery. Root canal means, one has to understand when the root canal is done.
Sure.
Why should it be done? So, root canal is done when your cavity reaches the nerve. I just want to show you something,
Please.
So, this is the cavity which starts, okay, small. This is small cavity.
Yeah.
Now, this small cavity, you don't get pain because enamel has got no nerve supply. So, you don't get pain. Kuch to atak jaya, something gets stuck in between. You say, ignore it. Then, if you don't do anything, it becomes a big cavity where you get sensation with cold. So, thanda lagta hai, cold sensation. That's the
Sensitivity.
time, sensitivity. That's the time the teeth, the decay dentin is exposed. Now also you don't go progress, then it progress further and it reaches the heart of the tooth. And when it reaches the heart of the tooth, you get pain on hot, basically. Then you get pain on chewing. Then you get swelling, there's an infection. And that's the time, the swelling, you get a swelling like this, the abscess comes out. That's the time the root canal is needed. Why? Because we have to take out this infection. There are 2 ways. One, remove the tooth, infection will be out. Second, you do the root canal wherein this is a root and this is a canal. Okay? So you remove the infection through the canal of the root. Tooth is very nice and firm in the bone and we save the tooth. That's the way the root canal is done. So root canal condition comes only you neglect it.
So, doctor, what measures can one take to prevent cavity?
There are 2 ways of preventing cavity. One is the home methods that we say brush. They say brush twice a day. I say no,
Day and night.
day and night. Brush once a day, once at night. Brush means you should know how to brush, which brush to use. Now, here I can show you brushes. Now, these are the brushes what we have here. Okay? Different size. These are the brushes I have. They are different size and also this brush is what we say is mechanized electric brush. Now, the most important part is how do you hold the brush and how do you brush. Now, brush has got 2, head And this is a head and this is a handle. So how do you hold the brush? You should not hold it tight. Hold it very lightly. If you hold it tight, you move from this and you just rub the enamel totally. The brush becomes like a flower. And that's the time you have to throw the brush. The brush bristles has to be straight. If the brush bristles are not straight, your teeth is not going to get clean. So you have to brush it very lightly. And then you have to change the brush after 3 months because the bristles become softer. Then the other side, there is something called tongue cleaner. Cleaning the tongue is very important. I'll come down to that later on. So this is the brush. This is a junior brush. You see the small head because the mouth is small. But there are some elder people who this brush doesn't reach at the last tooth. So I
This is
advise
the large brush.
this is a normal brush. So junior brush is small. So you can just put it inside and move the brush. Is basically remove the soft food particles. It's like dusting. It's not मैं जोर से करेंगे. If I brush heavy, I got the teeth become white. They become more yellow because enamel goes away. And then we got a soft brush. If people don't have a gum problems, so it's very soft brush. So that and too many bristles, so that it doesn't damage the gums. The gums are a little weak. So that's how is brushing. But the toothpaste, how do you toothpaste is very important. People take a toothpaste in a straight manner like this. You see that aesthetic way. That's not a correct way to, because half the toothpaste go down in the sink. So the way you take the toothpaste is to take it like this, take it vertical, press against the bristles. So now the toothpaste has gone inside the bristles so that you can brush it properly. So brushing is one of the most important aspect. And then comes this floss. Now people say, I floss. I say, show me how do you floss. Okay. They take out like this. They will take out this much floss. They will do like this and try. Doctor, nahi jamta hai. It's not happening. But this is a wrong way. So one should learn how to take the floss and how to use it. So the floss has to be taken out about 12 to 18 inches. And then roll against the middle finger. This is the way. Hold the floss with index finger and thumb, and then you can move it. Sometimes you get stuck, and then pull it out. So flossing is another important aspect. So you have toothbrush, floss twice, once a day, once at night. Mouthwash under the recommendation of a dentist, because mouthwash will reach certain areas where your brush and floss can't reach and you've got a little bit of halitosis. This is a home remedy. And of course the diet. Diet has to be self-cleansing. In a sense, you have to have fibrous food. So it cleans the food particles, it cleans your teeth naturally. So diet is very important. And then you have to visit a dentist every 6 months. Why 6 months? Because that small cavity which I showed you in the enamel, to go from enamel to dentin, it will take 6-8 months. So catch them young or prevent. Let me tell you, only dentistry can prevent 100%. If you follow instructions, 100%. Preventive medicine बोला, preventive ये बोला, मुझे पता नहीं है कि I don't know whether it's possible or not. They say heart problem, you have to do ABCD, diabetes, you have to do. I don't know, it's happening because you can't see anything in the body. But as far as mouth is concerned, like skin, you can 100% you can prevent the problems. The most important area to brush is this area. Inside. यहाँ तो, brush doesn't reach this area. You always brush this outside. But this area, because there is a salivary gland, saliva comes out from here. Saliva has also got chemicals, calcium जैसे होते हैं, and then the food particles, they become tartar, become hard. So to brush this area brushing is very, very, very important.
So doctor,
And those who can't brush and they've got a habit of brushing, at the age of 30, 35, I can't change. The habit, then you take this brush, you just have to hold on the tooth surface, don't have to give any pressure, and it will clean. Just move all over very lightly and it will do the job.
No, doctor, thank you so much. You've shown us the right way to brush, the right way to use the floss, the right toothpaste to use. But there are so many interesting questions what I have for you based on what you said. Number one, out of my personal experience, I used to use hard bristles brush back in the days. But when I went to the dentist, they said ki it has been banned by many of the countries.
Soft, medium, super soft, depending on what dentist tell you, depending on what problems you have. I told you super soft for gum problems, regular brush for regular toothpaste, etc. Hard brush is a concept which only came in India because I still remember when I was a child, I was using a tooth powder called monkey tooth powder. It's a very, very interesting story happened. My patient was sitting on the chair, and he asked me like this, Doc, what's your opinion on monkey tooth powder? I looked at him and I said, well, teeth become like a monkey teeth. He looks at me and tells me, I'm the owner of monkey tooth powder manufacturer. So then why you're making, that time you told me, as you go interior, the more rough the powder is, they love it. So that's the reason. But I will get into the, no particle size powders, etc. So that's the reason that concept of cleaning was using anything rough, hard, and all those stuff. But as dentistry progressed, and as dentists started telling people what is the right way to brush, what should be the particle size of your toothpaste, etc. Actually, if you see, brush per se doesn't cause damage to your teeth. How? Because your brush bristles are soft. So if my brush bristles are soft and I'm using it regularly down, brush will get damaged, but this is harder than brush. So what is that damaged the brush is a wrong technique with wrong toothpaste. Now what is wrong toothpaste? The particle size of the toothpaste.
So what do you exactly mean by this? The wrong particle size?
When you see the toothpaste, the particle size, that's clinically. But they are supposed to tell you can ask a question, consumer question. They are supposed to tell you the value of the particle size, which is measured in something called RDA. Now, RDA values should be less than 70. 30 is the best. Less than 70 is the micro abrasion. Now, you require certain abrasive. For that. So, it's micro abrasive. Okay? So, that's below 70. Anything between 70 RDA to 100, 150 RDA is medium abrasive. Now, that medium abrasive are supposed to remove the stains like pan stains or something, but not regular. It should be under the guidance of a toothpaste. Guidance of the dentist. And there are others which are more than 200 RDA, a so-called whitening toothpaste to remove the stains. They don't actually whiten the teeth, but they remove the stains.
So doctor, as per you, what is the right toothpaste one should use in their daily life to keep their teeth and their gums secure?
One toothpaste when I was a child called Forange, and that toothpaste was without foam, but it was good. Foam, you feel that. See, basically toothpaste is a vehicle to, to make you initiate you to just start brushing.
Right.
You require some. Otherwise, you brush with baking soda and toothbrush and water is no problem. You have to remove the food particles. But there are medicated toothpaste. There are toothpaste with fluoride that can avoid dental decay. Fluoride make your enamel acid resistance. So for children, we recommend fluoride. But that's also under the guidance of dentists because in India, there is something called fluoride belt, etc. So to be very careful that. So fluoride toothpaste is pretty good enough all over the world for children to avoid dental decay. Then we had medicated toothpaste for gum problem, So that's for particular reasons. So the best person to advise you what toothpaste you should use is your dentist. Now we are coming up, there is a company coming up with something called natural with nanotechnology. Total natural toothpaste. Toothpaste as well as mouthwash. You can drink that mouthwash. It's very soon it will be in market. So it's a mouthwash where you can drink because everything is natural. They don't say organic. Organic has been misused very often. It's natural toothpaste and mouthwash. So it's pretty good enough. Fluoride toothpaste, one should not swallow, etc. But then nobody swallows that toothpaste. Nothing happens to them. So toothpaste is whatever you taste you like, but see that the particle size. So regular toothpaste, many of the toothpaste don't have that particle size. But there are few toothpaste that have got more particle size manufacturers because nobody knows how to check the particle size. It's usually that checking is done in very high in USA and other places, big companies, corporate might be doing it at on particle size. Yes.
So, doctor, is there any right particle size that has been approved by the FDA?
That's why below 70.
Below 70 is something
RDA.
approved. Huh.
And there is something called enamel abrasion also. So one has to, a time has come, and I feel the time has come that all of us should know why we are using particular toothpaste. We are using particular toothpaste regularly. We are using particular toothpaste for anti-cavity, particular toothpaste for gums, or particular toothpaste for whitening to remove the stains on my teeth. Your natural enamel color will not become white with any toothpaste unless it contains the chemical which will change a whitening chemical like hydrogen peroxide or other chemicals which will change the chemist little bit of whitening effect.
So, doctor, one thing I want to ask you out of curiosity, what I've heard, not sure whether this is a myth or a fact, that if you do a lot of procedures or a lot of things you do for the whitening of your teeth, that can impact your teeth enamel as well.
Whitening of teeth due to what? I mean, you're talking of
Due to some
you're talking of toothpaste or you're talking of whitening by dentists professionally?
typically by professionally, this is
No, professionally it is proved that nothing can
nothing can happen.
Nothing can happen.
Okay.
You
This
go
is
for
a
facial, you go
learning.
for skin something, once in a year, once in 2-3 years, nothing can happen. Whitening toothpaste का जो है, that has to be basically use it for remove the stains and make the teeth brighter.
Sure. So, doctor, there was a very interesting fact what you mentioned that one should, sort of brush at the back of their teeth as well, जो सामने के दो दांत हैं, lower ones. But what I want to know that is this the main cause of bad breath? If you don't brush there, that is the root cause of bad breath. And secondly, can one get cavity there or not?
No, cavity doesn't happen in the front teeth because smooth surface, the foot packer doesn't say, is only tartar formation. You talked about bad breath. Bad breath reasons are 3 basically, or maybe 4. One reason is the dental problem. Now you can see when your teeth are normal, the gums are normal. Okay? Little bit of gingivitis, when the plaque stays there, little gingivitis, you get gums become red, then the bleeding starts. But if you don't clean at this stage, from this stage it goes to this stage, you can see the tartar has gone below the gums. Now this is the problem which we face. The tartar, you go for cleaning, doc, I did the cleaning just 2 months back, but still bleeding gums, still bad breath. Now the cleaning has done, which is the above the gums. You see the tartar is inside between the gums and the teeth. That gives a little bit of swelling, and that causes the bad breath, because when you get inflammatory blood coming or subsequently pus coming out, then you get bad breath. So that is the reason of the teeth. And then if there are gap between the teeth, food particles stay overnight, cavity in the teeth, food particles stay overnight, they get ferment and back. So these are the oral hygiene reasons for bad breath. Okay. Second is mouth mein. Sure. One is tongue. If you see the coating of the tongue on the back side, dorsum बोलते पीछे बाजू में, and see there is a coating white, then that gives the bad smell. That is one reason, oral cavity. Second, stomach upset. Then comes is the acidity, irregular food habits. So you get that smell coming from the stomach. Third is the chest. You got a cough, cold, etc. So you get those. These are the reasons for bad breath. So when we open the mouth and we say, "Arey, your mouth is clean, आपका मुंह तो एकदम अच्छा है." So there could be some other reason for the bad breath. Here I would like to tell you one thing, sir. You should have one person in your life close to you, maybe family, maybe friend, maybe relative, anybody, who should tell you there's some bad breath to your mouth.
This is an unspoken truth. Like, many people, they shy away from this fact कि मेरा bad breath है.
उनको पता ही नहीं होता. See, bad breath is what? It's like a perfume. मैंने perfume, I use my perfume. I get the smell for first, say 10 seconds, 20 seconds. My nose gets saturated. I don't get the smell of my own perfume. You will get it. Similarly, bad breath, I don't get. If I have a bad breath, I will not get the smell. You will get it. So, like for me, I got my sister. She works with me. Whenever there is a late night acid, Sandesh, acid, just mouthwash, use mouthwash, something like that. Or smell karo. So you should be people are so clean about themselves. They are dressed with all designer stuff. They carry everything, and when they speak, you feel like, I look there and talk to him. Because my smell is coming straight in the mouth.
अगर आपका tongue clean नहीं है, the back coating of it, that can also lead to bad breath. So what is the right way to clean your tongue?
See, you'll be surprised. Tongue cleaner came in India. You know, our forefathers were using that U-shaped tongue cleaner with silver metal करते थे.
हाँ जी, हाँ जी.
अमेरिका में 90s में आया. People know, you know, of course, I don't know why. So there are two things. You know, one is the toothbrush has got bad end, but then one can use the tongue. You don't have to go quite behind. See in the mirror. If you have coating, then go a little more. Otherwise, just casual, just to remove the coating what we have. Even brush bristles can do that job.
आजकल की जनरेशन में ना वेपिंग इज हाईली मतलब पॉपुलर. मेनी पीपल आर वेपिंग. स्मोकिंग तो चलो बहुत टाइम से कर रहे हैं. आई जस्ट वांट टू नो द इफेक्ट्स ऑफ वेपिंग ऑन योर टीथ एंड ऑफ कोर्स द आफ्टर इफेक्ट्स एज वेल.
Anything which is not normal to the oral cavity, and if it is used excess, is going to damage. It's not only vaping, but even colas also. Okay, so smoking, vaping, whatever you do, can damage the soft tissues as well as hard tissue depending on what you're having. Nicotine होगा तो stains आ जाएंगे. On the oral cavity, there could be some changes on the oral cavity. Now that leads to sometimes if it is a white patch that will lead to called pre-cancer that can lead to something else. But वेपिन से मैंने तो अभी तक देखा नहीं है कि उसको कैंसर भी शुरू है. But that's basically not good if you're using it too much of it.
So typically that is bad for your lungs, which can cause bad
That,
breath.
yeah, that's another aspect to look at. Bad breath का एक ऐसा है ना कि when you you know if you see anybody drinking a lot, you know you see a lot of servants and drivers and all. बात when they're talking, बात करते करते भी smell आते हैं because that's in the system. You know bad breath. That's in the system. So वैसे smokers, the moment they speak, even if they are not spoken now, they are not taken a smoke 2 hours back, but their system में.
So like many people, they also consume gutka, tobacco and all, and I think that is the main cause of oral cancer.
That's the main reason for oral cancer. Like gutka causes what we call as a submucous fibrosis. Your mouth can't open too much. Your tissue, you know, cheeks are very soft. But गुटखा से it becomes slowly hard, tongue becomes hard, fibrous हो जाते हैं. You know, got 4 layers of the tissue, soft tissue in the mouth. एक केराटिनस लेयर होता है, उसको एपिथेलियल बोलते हैं, कनेक्टिव टिश्यू जिसमें फाइब्रस होते हैं, एंड देन पेरियोस्टम बोन रहता है. ये जो थर्ड लेयर है उसमें फाइबर्स ज़्यादा हो गए तो मुंह खुलता नहीं, योर माउथ डजंट ओपन, योर टंग बिकम्स स्लर. And then when your mouth is not opening and your teeth becomes very sharp, etc., that creates an ulcer, and ulcer से आपको cancer हो सकता है. And then you have this tobacco and all keeping here, white patch हो गया तो you get a cancer. Pre-cancer होता है वो, and that pre-cancer converts into cancer. But whatever you keep there, people don't get kick after a couple of months, so they keep it for more time, then they keep it on the, you know, like go on and pre-cancer condition से उससे cancer हो सकता है. The point which I'm very surprised, not surprised, but what I wish to do, what my intention or my wish to stop oral cancer is not only to have cancer hospitals to, you know, nobody can cure that cancer so much. Is how do you prevent it? Prevention is very important. So instead of having oral cancer hospitals, I think one should start something called as oral pre-cancer centers. Pre-cancer, the moment you say pre-cancer बोलेंगे तो लोग जाएंगे वहाँ. कैंसर बोलेंगे तो अभी क्या कैंसर, मुझे हुआ ही नहीं तो मैं क्यों जाऊँ, हुआ ही नहीं तो मैं क्यों जाऊँ. अच्छा, no one is going to say मुझे कैंसर, you know, I don't have cancer but मैं ऐसे ही चेकअप के लिए आया हूँ. I've just gone. Nobody will go to cancer hospital for that. But if you have a pre-cancer hospital or clinics, and they go there and check if there's a white patch, you take that white patch और cancer नहीं होगा. So taking that white patch out, you might prevent cancer further. Second and most important, which is very, 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 very sad, is celebrities doing advertisements. May not be directly for gutka, pan masala, do it for ilaichi, but I've seen a poster of a celebrity who had done advertisement of ilaichi, eating like this, okay? Ilaichi. Niche in a small microscopic sentence ilaichi. Backside is the design of a pan, betel nut. पान का बैकग्राउंड बनाया है. So that is called surrogate advertisement. That means you are advertising for elaichi, which is making you happy. You get money, celebrities. But you don't understand that you are promoting this. Every child has got a mentor. मैं सचिन तेंदुलकर जैसा बनूंगा, मैं शाहरुख खान जैसा बनूंगा, मैं वो क्या करते हैं मैं करूंगा. They feel that is a necessity to get that status. One should not do that. And I found only two celebrities. One, definitely, I found him years back, is Sachin Tendulkar. He has refused the advertisement in spite of getting a blank check. I promised my father I will not do advertisement of any product that will affect the youth and the human being. And recently I heard about Anil Kapoor. He's also a very close friend of mine. So I always call him my hero. He refused 10 CR, 10 crores. So sometimes I feel, well, you can. God will give you money, yaar. But what you are creating about impression about what gutka and pan masala is to, in a different way. You are right in doing elaichi advertisement, but that's a surrogate advertisement.
So doctor, what you are saying now, I like truly resonate with that. Only because अभी शाहरुख खान ने भी इंटरव्यू में बोला that he has stopped smoking. And if you see the उसका जो effect है of him only saying that I have stopped smoking, I have seen so many comments, so many people, commenting that we also will stop smoking now. So people, they really look at their role models, the way they act, the way they speak, the way they, move their hands, and that sort of they pick subconsciously or consciously. So I really believe that these mega stars should also promote the right brands.
No, talking about that, that's impact, what we call emotional impact and all those things. But I'll talk about financial. I know Shahrukh because he was my patient for 25 years, so I know exactly what he is. Did you read the fine line? Because he has stopped smoking, he is getting now good advertisement for the youth products. So paisa aane ka to kahan se bhi aayega na? You don't have to do this. But if you refuse and if you stop certain things, you get, so God balances everything.
बस डॉक्टर को ये जानना है कि when people they smoke and they vape, I mean aesthetically their lips also gets dark. तो exactly इसका क्या वो है?
See, क्या मैंने बताया ना 3 लेयर, केराटिनाइज लेयर होता है, एपिथेलियल लेयर होता है. ये जो लेयर है ना, that layer becomes where becomes, see your lips are pink because of the blood circulation. Then you are stopping that blood circulation by heat or whatever the reason is, and then that layer becomes thick layer. Then that thing happens. People who have pipe, they got a depression here. They got a depression on their teeth also. They hold the pipe with the teeth. So anything rubbed again and again is cause to damage. Na? Water can damage the hardest substance like marble bolo or stone bolo. पानी तो कैसा कर, पर बार हीट होने से जैसे every time you hit that stone again and again, it just wears off. Similarly happens with you.
So circling back our discussion to something fun, whom do you think in Bollywood has the best teeth?
See, in Bollywood, I don't see a teeth like, what should I say, healthy teeth bolega,
Healthy teeth.
Ekdam healthy teeth, you'll be surprised. Healthy teeth with no cavity, and I was treating for 20 years, Lata Mangeshkar. She didn't have a single cavity. She had only one tooth, which was, I told you that she came to my boss for root canal in 1980s. The same tooth we treated, but same tooth I kept it there I didn't remove it. See, removal of any teeth is little psychological effect on the patient, especially celebrities like Didi and all. So what we did was, we kept the upper portion of the tooth, splinted, बाजू के दांत को बांध के रखा, नीचे का infected root निकाल दिया. So when she smiled, she got original teeth. Plus मैंने पकड़ के रखा था for 20 years. So she had a no cavity teeth. She had really nice teeth. Second, हमारा problem क्या है? People after problem only they come here. So then there are very few people who come without problem. अरे मेरे दांत अच्छे हैं तो maintain करो वैसे.
When you see movies, when you see some of the celebs on TV, whom do you think has the best smile?
The smile is very subjective, but smile is also beyond pink and white.
Yes.
Smile is not only teeth. Smile is your expression. So, the smile is a curvature which passes through the eyes. And I have seen people having crooked teeth, but क्या smile है? Because confidence होता है.
Shahrukh Khan is
Shah
there,
Rukh
I
Khan,
think, I'm
Akshay
sure.
Kumar, the way they smile, people say Madhuri Dixit, Deepika Padukone. So smile
Subjective हो
is,
गया ये.
is smile, everybody's smile is good if they are confident about their smile. So crooked दांत वाला भी अच्छा दिखता है. I admire those people, and when I want to see anybody smile, I look their eyes. That will tell me whether they are confident or not.
अच्छा.
हाँ, people with see, there's a difference between good smile and healthy teeth. So basically your teeth has to be healthy. उसके बाद आप कैसे कैरी करते हैं. Now you see many people carry dress पहनते हैं typical color, but there are people who carry pink shirt, red shirt, yellow shirt. You see Ranveer Singh, he carries himself. So it's all depends on how you carry yourself, how confident you are with your smile. So you see Madonna having gap in the teeth, but she carries herself.
From your personal experience, I want to know what impact does self-confidence have if you have good teeth?
It all depends on you कि हम कैसे दिखते हैं. है ना, आई एम कॉन्फिडेंट अबाउट माई सेल्फ. पीपल शुड नॉट आस्क मैं कैसा दिखता हूँ, मेरी स्माइल कैसी है. सो व्हेन पीपल कम एंड टेल मी डॉक आई वांट टू चेंज माई, बट व्हाट यू फील अबाउट योर स्माइल, आपको क्या लगता है, इसमें क्या गड़बड़ी लगती है. मेरे को तो सब अच्छा लगता है. एनीथिंग हेल्दी इज गुड फॉर मी, बट अभी उसके आगे मॉडिफिकेशन करना है. या बट वन थिंग इज वेरी इंपॉर्टेंट कि हम स्माइल करते इफ देयर इज अ प्रॉब्लम विद द फंक्शन, दांत क्रुकेट है, कैविटी होने वाली है, you know that those things doesn't sometimes look nice. I mean function के लिए, but दिखने के लिए is all they what they carry themselves.
So one interesting question of what I want to ask you, that is there any home remedy to make your lips pink, and if you have darker lips that can help you to change it into pink?
There is nothing called remedy with the dark lip.
काफी लोग बोलते हैं कि शेयर लगाओ.
नहीं नहीं
वो करो.
नहीं. See, अभी गम्स का मैं बात कर सकता हूँ. किसी के गम्स काले होते हैं, डार्क गम्स.
Right.
There's a pigmentation. We remove that pigment. जैसा बोला ना, एक लेयर निकाल दिया, you get that pink layer. After some time the pigmentation will come back. So it's like वो जो पहले आता था ना, ये यूज करो आप फेयर हो जाएंगे, फेयर एंड लवली, वैसा कुछ आता था ना, फेयर. सो देयर इज नथिंग कॉल कि मैं गोरा हो जाऊंगा. द ओनली पर्सन आई हैव सीन हु हैज बिकम फेयर इज माइकल जैक्सन. बट विद ऑल द सर्जरी, बट देयर नेचुरली पिगमेंटेशन जो है कि आपका स्किन टोन, इनका स्किन टोन, मेरा स्किन टोन इज द सेम. उसको छेड़छाड़ करने को जाएंगे तो डोंट नो व्हाट रिजल्ट्स. देयर इज नो प्रोसीजर टू गेट. सो देयर आर टू टाइप्स ऑफ प्लास्टिक सर्जरी प्रोसीजर. वन इज टू रिपेयर, one is to enhance. While enhancing, if you get into trouble, there is no procedure. You can't change the nature, and don't try to change the nature. Don't
Just
try
be
to
the
change.
way you are.
Yeah. That's the way you are. I mean, as I'm looking at your nose, so I can say people who have got a little bit of sharp or out nose, their teeth are little out, because God has balances the profile. If you see smile, your teeth, front two teeth are little out. That looks nice because it's going balancing with your this way. Chin is also out. So that's the God has given you that. The deformity, little deformity is called attractive. Too much deformity is called ugly. So too much deformity होगा तो हम कुछ कर सकते हैं. So my sentence is very simple. Imperfection is perfection in human being. That's my sentence.
So circling back to our discussion to what you said, that you had this manifestation that Lata ji would come to your clinic one day, and she did. So do you somehow believe in law of manifestation?
200%. And I have experienced that.
So can you just elaborate?
When my father died, in 1970, when I was in school, so we were staying in a small room. So I was studying. I was in 11th at that time, SSC 10th, and they used to be crying. And I said, "No, yaar, my father is there somewhere. My mother is there somewhere." ऐसा करके छोड़ देता था. I should leave. He is there somewhere. Then, if at all I want to do anything, I used to look at my father's, and I said, "Okay, am I right doing this and that?" I should chat with him. Just chat me, not chat. अरे यार, कुछ करना है लाइफ में तो. Days passed by. I became a dentist, successful dentist. In 2007, I had a patient who came from Hyderabad. He came with his friend, and then I'm cutting it short because we became friends. And he said, "I own Krishnapatnam Port." This is 2007-8. Why don't you come? So we used to go there, weekends go, relax and all. 2014, he celebrated my birthday at the port in a big way. I took my friends and all. So there, I saw his social service was 6,000 workers, रहना खाना पीना free. I realized one thing, if workers का पेट भर गया ना तो काम अच्छा होता है. पैसा ज़्यादा मत दो. पैसा वो कहाँ भी यूज कर सकते हैं. Money they will use somewhere else. Give them food. I said, you are doing so much social service. Why don't you start dental clinic? He said, you Bombay wala aayega? I said, I'll come. So I used to go there Friday evening, closing my practice. Chennai, 7 o'clock flight, 8 o'clock, 9 o'clock Chennai, 12:30 Krishnapatnam port, Saturday work from 10 to 5, Sunday 10 to 2, Sunday back. And we became very close. And they were surprised कि मैं उधर कैसा जा रहा हूँ. I said, I love this guy. And he used to do anything. My daughter wanted, like to stay in London, so his friend's flat was there. We loved each other. Now comes 2016, and I get to know his birth date, 29 January 1971. So I called him up and wished him. I said, Shashi, what time was your birth? So he said, 4:30. My father died, 29 January 1971 at 2:45. My father was working in Bombay Port Trust. All his life he was related to port. All his life he wanted me to join ship. And here is a guy born on the same. And the last straw was, he looks like my father. So I manifested that time that there is my father somewhere. So that's a very big thing. There are many people who say we don't believe in reincarnation and all this stuff. I also don't believe in reincarnation, but I got a live example. He can do anything for me. I can do anything for him. That's the relationship we developed before we came to know that this is a relationship we have. So I have got tremendous examples of manifestation. Manifestation only comes only if a heart is clean. And your mind is, you don't have a selfish motto. You have a clean motto. And that's what I learned from my father. We Mayakers, we like to help others. And he said that only lucky people get chance to help somebody. And that's we follow. Only lucky people get chance to help somebody. And that's what he does. So I could see all what my father was doing is in him.
And Doctor, can I also put it this way, that law of manifestation is the great tool to make your hard work turn into success? Because like everybody, they do like hard work, but some people, they doubt their, sort of capabilities. They don't have confidence level. And some people, they hard work with full confidence and they believe in the manifestation powers, where they keep on visioning them getting the success they want. And they become highly successful. Of course, there should be some good motto attached to it, not a personal benefit कि उनको बहुत पैसा मिल जाएगा.
हाँ, वो पैसा मिल जाएगा मोटो से कुछ नहीं होता है. दैट इज नॉट कॉल्ड मैनिफेस्टेशन. मैनिफेस्टेशन से जैसे फर्स्ट टाइम व्हेन आई स्टार्टेड माय प्रैक्टिस, इंपोर्टेड गाड़ी वाला पेशेंट आया तो आई वाज वेरी एक्साइटेड. Then first time when Shahrukh came in 92, but other people started coming, I got excited. Then Lata Didi came in 2004, I got excited. That manifestation is okay. But I was not working. I was not doing so-called PR to get them to my clinic. PR has to happen in our field. See, there are different fields. In say Bollywood, they say negative publicity also publicity. You have to be seen to people, whatever it is. But in profession, it's only positive. It's your reputation. And to build reputation, whether a class 4, like a liftman आता है, का बंगले का owner आता है, you have to treat them the same way.
And doctor, one thing I want to ask you, what role does positive thinking have in order to become highly successful in life?
There are 3 things you have to be in positive. You have to believe there is Almighty. Second, you have to believe जो होता है तेरे लिए अच्छा होता है, सबके लिए अच्छा होता है. जो होता है सबके लिए अच्छा. When you say जो होता है सबके लिए अच्छा होता है बोलेगा तो you see everything positive. I'm telling you my story. Now, heart operation हो गया. The first thing I did was didn't go home. I went to Taj Landsend. I stayed next to Shahrukh's house only. So Taj Landsend में गया. I said 14 days मेरे को यहाँ रहना है. There was a big wedding in my family. So I told my wife to be जा. Now here is the story. Everyone said, wife, you told her to go, she went. I said, I forced her to go. I said, तू नहीं जाएगी तो मैं, I will not cure fast. I will not recover fast. You know why? I can't see myself what is my condition. But the opposite person becomes my mirror. His expression tells me how good or bad I am. And I don't want to have that expression. She is concerned about me. ये चाहिए, वो चाहिए, वो चाहिए. So I sent her Mexico and I was on the video call at night. And I was to see, अरे ये सब मेक्सिको में, मैं भगवान मेरे बाजू में थे, मतलब क्या किया यार, वो सब मेक्सिको में मजा करते हैं, एंजॉय मेक्सिको, यू मेड मी स्लीप. एंड देन आफ्टर आई वाज इन टीयर्स एंड आफ्टर 5 मिनट्स इसमें से कुछ अच्छा निकलेगा, ऐसा करके सो गया. यू नो व्हाट हैपेंड आफ्टर माय ऑपरेशन? माय डायबिटीज वेंट अवे. So there is no blood sugar for me now.
That much impact positive thinking can have.
Can happen.
I mean, not directly but indirectly as well.
डायरेक्टली बोलो, इसमें इनडायरेक्ट क्या है? मेरा डायबिटीज चला गया.
तो इनडायरेक्टली वो आपकी थिंकिंग ने ये भी कर दिया.
लोग क्या करते हैं, देखो मेरे को इतना पेन होता है, मेरे को ये होता है, कि मतलब मैं हार्ट ऑपरेशन को डॉक्टर को पूछा नहीं क्या है करके. टू बी वेरी फ्रैंक, आई डिडंट इवन नो कि मेरा वो स्टर्नम कट करके ओपन किया, ये किया, वो किया. आपको मालूम करके, मेरे दांत है, लेकिन मालूम करके करेंगे क्या आप? यू आर टेकिंग दैट बर्ड इन योर माइंड विच इज नॉट करेक्ट. हाफ नॉलेज इज नॉट करेक्ट. वैसा है वो. सो माई रिक्वेस्ट टू यू ऑल्सो, आपका रूट कैनाल हुआ, डॉक्टर ने किया है, क्यों किया है, अच्छा किया है, नहीं अच्छा किया है, क्यों नहीं अच्छा किया है, अच्छा कैसा करना चाहिए, पीरियड. ऑल ओवर यार, कर भला तो हो भला इज माई सेंटेंस. कर भला तो हो भला भी क्या. अच्छा, दूसरा क्या है पॉजिटिव थिंकिंग में, मैं आपको हेल्प करेगा. आई एम नॉट एक्सपेक्टिंग यू विल हेल्प मी, ही विल हेल्प मी. सो समटाइम्स यू हैव टू एनालाइज योर सेल्फ कि ये मेरे को कैसा होगा. फ्रॉम चॉल, born and 34 years in Chaul. Today I own a bungalow next to Shah Rukh Khan in Bandra Bandstand. This comes only with goodwill, not with money.
So in case of Shah Rukh Khan, I saw some of his interviews where he, sort of had this manifestation and this positive thinking that I'm gonna own Mannat building at some point. And eventually he did through hard work, through, many other things. But somehow there is some power to the law of manifestation and to the positive thinking that made his vision turn into a reality.
In our profession, we being professional, we don't calculate money. I did my course in business management. I want to join Harvard, but they say it's not. So I did ISB ka, AMP, Accelerated Management. So there are two difference. Professional काम करते हैं, पैसा बाद में आएगा. Business में पहला पैसा कमाओ. Business is to earn money. Professionals is to work. So professionals are recognized by reputation. No one goes to a rich doctor. Businessmen are recognized by finances because I want to invest in their businesses. So one of the positiveness is that you fight with you. You improve yourself, enhance yourself, upgrade yourself, go up and up yourself. I can't compare myself with Ambani, Adani and Shah Rukh and they have got their own problems. They have got their own happiness. I got my own happiness, own problems. And I got my own solutions. Grass is green on the other side.
Exactly.
मैं मेरा grass देखता है, बाकी कौन सा भी होना.
Like you feel happiness and fulfillment in your own achievement, not by what they are doing, what किसी और की क्या है.
कि पैसा कमाना है और मेरे को मुझे टू बी वेरी फ्रैंक, आई डोंट नो व्हाट्स माय बैंक बैलेंस. माय वाइफ भी चार्टर्ड अकाउंटेंट, शी चेक्स, माय सिस्टर लुक्स आफ्टर माय क्लिनिक. कितने लोगों का पैसा आना है. देयर इज वन बिग एक्ट्रेस इज नॉट पेइंग मी ब्लडी 6.5 lakhs of rupees. आई डोंट नो व्हाट, बट आई एम नॉट फॉट विथ हर. आई एम स्टिल सेंडिंग मैसेज, प्लीज पे यार. इतना काम किया, डे एंड नाइट काम किया. उसका गोवा में दांत टूटा तो मैं गोवा में खुद टैक्सी लाके तंबू में उसका दांत बनाया बिकॉज शूटिंग चालू थी. आएगा कुछ तो प्रॉब्लम होगा उसका, आएगा.
थ्रू दिस पॉडकास्ट क्या मैसेज पहुंच जाए.
नहीं, आई स्टिल लव हर है, जो है वो है यार. क्या सी, मैं हमेशा बोलता हूँ, आई स्टिल रिमेम्बर माय डॉटर से ये दिन, इफ ही डजंट पे मी 7,500, गॉड विल गिव मी 75,000. बट मुझे बोलना नहीं कि उसका क्या प्रॉब्लम होगा. एंड दैट इज देयर.
So thank you so much, doctor, for being here. It was truly a very good podcast. Learned a lot about aesthetic dentistry and how to take good care of oral hygiene. And number 2, how law of manifestation is for real and you experience in your own life as well. It was good to have a brief on that. And thirdly, the impact of positive thinking in your life. So thank you so much for being here.